Hi, my name is Ken Hekman. Welcome to this training course called 4 Essential Disciplines, a training guide for healthcare leaders worldwide. My colleague, Quinton Friesen, and I are going to lead you through 15 modules to help you improve your knowledge, skills, and attitudes as a healthcare leader. This is Module 1 of 15. This course is based on my book entitled 4 Essential Disciplines and reflects my work as a leadership coach and trainer with hundreds of healthcare organizations in over 30 countries on 5 continents. Quinton will be sharing from his experience as a seasoned hospital executive in the United States. He has also worked as a trainer and consultant to faith-based hospitals in Africa and Latin America. The 4 essential disciplines we will be discussing are leadership, management, sustainability, and service. Our goal is to help you grow as a healthcare leader so you can be more effective in delivering healthcare services to those who need it most. We have come to understand that good medical care doesn't depend just on good physicians. Even the best physicians need the support of nurses, ancillary staff, and the business skills of financial managers, human resource managers, supply chain managers, and strategic leaders. Effective, high-quality care requires a team. The 4 essential disciplines can help you build your team.
This course has been designed to include short case studies and study questions with common challenges to stimulate discussion with your colleagues in your context of your own culture. We realize that sound principles are not enough to assure good quality care. These principles need to be adapted to the culture in which they are to function. They need to reflect the context, the values, and the organizational dynamics of your hospital or clinic to be most effective.
Your successful completion of all the modules and your completion of online assessments can help you achieve a certificate provided by Medical Missions for Children. This course is produced by Medical Missions for Children. Each module begins with learning objectives in which we will outline the content. In this introduction module, our objectives are that you will understand the purposes of healthcare organizations, recognize the marks of successful healthcare organizations, understand the roles of leaders and managers in healthcare organizations, and appreciate the challenges physicians face as they move into leadership roles.
Ken, let's begin with a question. What are the most important purposes of a hospital or healthcare organization?
The answers might seem obvious at first, but I think they deserve a second look. The first right answer is that hospitals are places of healing. They are the workshops for physicians and other healing professionals. But healthcare organizations can also work to prevent illness and develop healthy communities. Every community needs 3 institutions to survive and thrive: business, education, and healthcare.
If healthcare organizations are so vital, how will we know if they are being effective?
We can begin by measuring clinical outcomes, but we shouldn't stop there. Healthcare is a uniquely human service, so we should look for indicators of satisfied clients, engaged workers, financial stability, and responsible growth.
What is the role of healthcare leaders and managers?
Healthcare leaders need to balance community needs with the resources of the healthcare organization. They make decisions, sometimes difficult decisions, because needs always outpace resources. And because these are uniquely human services, they need to inspire people to work toward common goals.
Ken, how are the roles of leaders and managers distinguished from each other?
Leaders focus on developing the direction for the organization, while managers focus on implementing those directions with operational efficiency. We have found that frequently physicians are placed in leadership roles in healthcare organizations, even though they have little or no training in professional management. This is especially true in developing economies. That can be challenging for physician leaders as they grow into their leadership roles. They must gradually refocus their time and their efforts from technical, medical, and professional activities to leadership and management activities. For some, the transition requires a grieving process as they leave behind the personal satisfaction that comes from the healing profession. They must find a new satisfaction in recognizing that their role as a healthcare leader can leverage their talents to improve services for the broader community.
Let's look closely at how management and medicine are fundamentally different, but also at what these two disciplines have in common. Managers work in teams rather than alone. They often have to make decisions with incomplete information, and they make changes by building consensus among groups. Physicians typically serve one patient at a time, are expected to be completely accurate with their diagnosis, and are taught to make independent judgments about treatment plans.
Despite these differences, managers and physicians share a few other qualities. They both use scientific methods to solve problems. They both feel compassion for others, and they continually look for ways to improve their methods and their organizations. At this stage, you may have more questions about leadership and management than you have answers. That's normal. Learning about leadership and management should be a lifelong journey. Quinton, has this been helpful so far?
Ken, it has been very helpful. Here are a couple of questions that many new managers may ask. For example, can leadership and management skills be learned?
I believe they can. Some may have more natural talent for leadership and management in the same way that some athletes have natural abilities for speed and agility. But I believe everyone who is responsible for leadership and management can improve by gaining knowledge, practicing skills, and building attitudes for success.
Here's another question, Ken. How can I assess my readiness for leadership and management?
There are many excellent resources for assessing and improving leadership skills, including books, courses, psychological assessments, and you can enlist the support of a leadership coach. Let your curiosity guide you in the search for resources that can help you best. This concludes Module 1 of 15 in the series on 4 essential disciplines. Thank you for participating. I hope what you have learned can increase your effectiveness as a leader or manager, and that you will want to learn more in the coming modules.
Learning experiences that are passive and that require nothing in return have limited effectiveness. Therefore, we encourage you to take some time to reflect on what you've learned. To help you, we will include a few questions or exercises in each module designed to stimulate your reflection, to glean ideas for applying what you have learned.
Take some time to discuss this very simple case study. Dr. C is an excellent surgeon, admired and trusted by everyone. You have been asked to comment about his readiness to become the leader of the hospital. Here's a simple case study for your discussion.
What qualities of Dr. C would you identify as most valuable for his new role? What might limit his effectiveness? What would you recommend he learn in the early stages to increase his leadership effectiveness?
We encourage you to discuss this module with others who are learning about leadership and management.